Let's focus on the health sector now. Midwives in public hospitals across the country are demanding what they describe as better working conditions. The group argues that its members have been denied the opportunity of career progression, with some others lacking adequate equipment to ensure better healthcare delivery. President of the association, Faustina Asamoah, made the appeal at the maiden conference of the Ghana Registered Nurses and Midwives Conference here in Accra.
It is our maiden conference because around the year 2013, the then leadership of the government registered midwives group under the GRNMA took the unfortunate decision to break away from the GRNA then to form another association. Frantic efforts were made to bring them back but failed. As legitimate as their reasons may appear, majority of midwives across the country did not back it. In 2017, some few members led by my good self started advocating for the reorganization of the majority group under the Mother Union. With this movement, out of about 27,000 midwives in the public sector, about 15,000 remain registered as GRNMA members, which has a major shift from the previous 2,000 membership. In 2018, the group was officially inaugurated at Ejisu in the Ashanti region during the International Nurses Day, and I was privileged to be its chairperson interim after the rebirth. I hope and pray that never again shall our torrid and unfortunate past be repeated. Madam President and our chairperson, the theme for our maiden conference is Midwives, a voice to lead in the midst of challenges of the healthcare system. The significance of this theme within the current age cannot be overemphasized, bearing in mind how COVID-19 exposed our healthcare systems across the globe, with Ghana not an exception. Despite the relatively fewer midwives in our healthcare delivery system, the majority of key health indicators are based on major work output of the midwife. Talk about the maternal mortality with its complexities, infant mortalities, neonatal mortality, stillbirth rates, antenatal, including prevention of mother-to-child transmission and postnatal services with its associated indicators. It is quite clear that, Madam Chairperson, that a midwife is key in any dialogue, policy development and implementation towards addressing major systemic challenges facing our healthcare delivery in Ghana. The midwife is key to achieving our set targets for the Sustainable Development Goals. Let me hasten to add that it is by no accident that a midwife is the first face you see when you enter this world. Madam Chairperson, permit me to echo that the fact that despite the critical role played by midwives in our health system, we are still faced with major challenges in our care delivery process. Number one, logistical challenges. Lack of logistics in most facilities hinder productivity. The provisions of what we call the computer tomography or the CTG.
These are the concerns of the general nurses and also midwives across the country. So let's expand this conversation and get the concerns of the group. Joining us now is General Secretary for the Ghana Registered Nurses and Midwives, David Tinkran. Thank you so much, sir, for your time. So exactly what are your concerns and why are you complaining that you don't have adequate facilities in your in your various departments?
All right. Good afternoon, my brother, and good afternoon to your viewers and listeners. I'd like to take this opportunity to extend my warmest felicitation to all nurses and midwives in Ghana, and especially midwives. Of course, I mean, yesterday we had a maiden conference for registered midwives that belongs to our organization, and as was recounted by the president or the chairperson, they have a myriad of constraints that mitigate the smooth running of their work. And the first thing that they talked about was logistical constraints. And I believe that these are major challenges that affect the healthcare delivery. I mean, she indicated that the first person you meet on earth is the midwife. And if they don't have the necessary logistics to help in delivery and monitoring of the fetal heart, and as I mentioned, the CTG machine, then obviously they will have a lot of challenges. They also mentioned about human resource when it comes to study leave policy that is skewed against them. They are not able to pursue academic levels based on what they set out to do for themselves. And these are some of the few challenges that they laid out. In fact, they have very poor condition of service. Most of the midwives find themselves in villages, health centers, CHIP centers, and they run virtually 24 hours, but they have no allowances going for them. I remember 2 years ago when we approached government to negotiate for necessary midwives in this country. We brought this to the attention of government that they need to have a rural incentive for the midwives that actually reside in these hard-to-reach areas. But up to today, we've served on several committees. We were told that the report is ready, but as I speak, they've not been able to implement the report. And these are some of the challenges that were laid out yesterday by the chairperson of the...
And what has been the engagement with government so far? Are you making any follow-ups on your concerns?
Exactly. On daily basis, we knock the doors of the Minister for Health and the Director of Human Resources. They keep assuring us that as far as the village incentive or the rural incentive is concerned, they are working tirelessly to get it implemented. But it's 2 years now and counting. That should tell you that people are not taking it kindly at all.
Paint the picture for us. How bad really is the situation across the country?
Okay, so as far as the human resource issue is concerned, and for that matter, the ability for them to be able to pursue higher education. Mind you, midwifery is actually a specialist program that in various jurisdictions is not a first level qualification. You have to actually complete your training in nursing before you pursue that. But some years back, about 13 years ago, we did a need assessment and we decided to bring midwifery training to first level at diploma level, all right? And it doesn't even make them competitive. All right. So if that's the case, then we need to make sure that they are able to get access to study leave so that they can pursue first degree, the master's degree, and the rest of it to be able to improve service delivery. As far as I'm concerned, they are ready to work, but they need the supportive items that will enable them to give up their best. So basically, these are some of the concerns that they have.
Are we likely to see an industrial action in the coming days? After all, we've seen the notice earlier over some of the allowances that have not been paid to your members. What are you considering at this moment as your option?
I'm not too sure we want to consider any strike action. We believe that the good people of this country deserve the best. More often than not, when we embark on the strike action, it doesn't affect the politician. It's just you and I who bear the brand of such things. And we believe that government should listen attentively to the plight of the midwives so that we are able to avoid any unforeseen circumstances. As far as I'm concerned, I'm not sure we've gotten there yet.
Right, and precisely that's why I'm asking the question, because there's an implication on healthcare delivery in many of the public facilities across the country.
Exactly. So that is why we keep asking government. You see, sometimes when we start like this, they don't tend to listen to us. So I just want to assure the good people of this country that midwives and nurses are not thinking of going on strike, but we want to tell government to improve the service conditions of nurses and midwives. Let me tell you, from 1st of January up to 1st of April, 2,500 nurses and midwives have left the shores of this country. And on daily basis, if you like, take your cameras to the Ministry of Health, you find a long queue of nurses and midwives buying clearance form, and they continue to buy if we don't do anything to motivate them and to change the narrative. If we don't change the narrative as far as the pay and allowances are concerned in this country, by the time we open our eyes, my brothers and sisters, they'll be left. They are leaving in droves. Okay, I have the statistics, but I don't want to put it out yet.
I mean, it won't be fair if you don't help us with the figures. So help us understand how the situation is. You mentioned over 2,000 nurses leaving just this year alone.
Yes, I've told you, from 1st of January to 1st of April, 2,500 nurses and midwives have left the shores of this country. All right. So if we don't do anything about their condition of service, it is going to be worse.
Are we certain that this is because of the poor conditions within which they are working, or perhaps they're just looking forward to working outside this country?
It's just because of the poor conditions which we find ourselves. Let me tell you, my brother, some of us have lived in this country for the past 22 years, working tirelessly as nurses and midwives, and we are still here. Okay, a time comes where avenues are open for other professionals to move out of this country. We decided to live in this country to serve our motherland. Our people are ever ready to stay in this country to serve the good people of this country. But if we don't improve their conditions of service, they will leave. All right. And migration is a right, and nobody can stop anybody from traveling. I keep saying that they have every right to better their lives everywhere. And for that matter, if they consider other jurisdictions as ideal for them to better their lot, they have to go. But I can assure the good people of this country that if government listen to the plights of the nurses and midwives in this country and address the concerns as we have laid out, majority of them will remain in this country and serve the good people.
Okay, so where do we start from? I guess that would be of paramount interest to everyone involved.
Well, I think, as I said, we did our negotiations. We completed our negotiations about 2.5 years ago, and some of the items were not implemented. All right, those items that are not seeing the light of day must be implemented urgently. Again, we made a demand because, don't forget that around 2001, between 1999 to 2005, there was this exodus and attrition of nurses and midwives. President Kufuor at the time had to put in various measures, including car waiver and the rest of it. That's why government decided to remove the car waiver, and anything that went to nurses and midwives was virtually removed. Okay, and we are back to square one. If government is able to bring back this car waiver and other things like that, it will help them for them to stay, okay, and improve their service conditions, salary and allowances and the rest of it. And as I've told you about study leave, the quota system is so bad that it doesn't help them. A midwife will be posted to a village and will be virtually forgotten. When they apply for study leave for 5, 6, 7 years, they've not gotten study leave to move out of that village. They are young ladies. How do you expect them to even find partners? All right. So these are some of the issues that affect our people. And if nothing is done about it, I can assure you that we will have a very difficult situation on our hands.
Okay, thank you for your time. That's David Tinkran, General Secretary of the Ghana Registered Nurses and Midwives Association.